Hey guys, so I'm finally back. So sorry for the long wait of the second updated part of this video. My life's been super crazy right now. We got a new puppy, which let me tell you, me and this dog, we just don't get along. We don't get along. I had a family member that was actually really ill, and I actually had a hiccup in my recovery process as well. But anyways, how I'm going to do this video is I'm just kind of going to go step by step throughout my entire experience, starting with my first appointment with the doctor when I got in Houston, all the way to the end to my recovery. So this video is probably going to be like just a little bit on the longer side, but let's get started. I'll attach my before and after photos at the end of this video as well. So my surgery date was July 11th, 2017. I did arrive in Houston 2 days prior to that date. However, I kind of wanted to go down there on a Sunday just to kind of get settled and checked into the hotel. And then the next day is actually when I had my first pre-op appointment with Dr. Cortes. And because I was an out-of-town patient, that's where I got to meet him. And he asked you kind of what you're looking for. And y'all discuss like wish picks and things like that. Now me personally, like I didn't have any wish picks. I kind of just like the work that he did, and I told him like, you're the surgeon, like you know what you're doing, just sculpt my body how you see fit. I just kind of told him like the main points of what I was looking for. Like I wanted all those rolls and whatnot in my back gone. I wanted my tummy flatter, obviously. And I wanted something that was like more natural but not too ostentatious on the ass side either. So after you go to your appointment with him, you do have to go get all of your lab work done at the hospital. So basically you have an appointment time that they'll give you. Whenever you go there, you first check in with the desk. Then after that, you go through the whole registration process. They ask you honestly like 50,000 times what procedure you're getting, just to confirm everything with you. You know, you'll be asked that question the day of your pre-op stuff and also the day of surgery. Every single doctor, anesthesiologist, etc. will come and ask you all those questions as well. And also something that if you're an out-of-town patient, that's on the packet that they give you the day prior to your surgery. It says take the iron capsules 2 days prior to your procedure. So honestly, the night of, like I was running around frantically. I actually used an app called Favor because I'm like hella lazy and it was storming really bad that night, to have the guy bring me my iron pills. Just make sure, and a lot of the stuff on the list of items that you need for your procedure, I actually didn't end up even using. I barely had any drainage, like from the incision sites or anything like that. The only drainage obviously that I had was the drains, the fluid going to the drains, and that's pretty much it. I didn't end up using the ab pads. Dr. Cortes actually gives you arnica pills, and he does prescribe you like the dilcolase, which is a stool softener, and all of that as well. So you don't need to bother yourself with getting that. So also in the packet that they give you, the paper that they give you will tell you to be at the hospital like an hour prior to surgery. However, when you go to your pre-op appointment, they actually want you there 3 hours prior. So my surgery was scheduled for 10:30, but I had to be there at 7:30 in the morning, and that's just really because in case there's a cancellation or something happens with the other person's blood work, etc., like they'll actually just move your surgery up. So you're there like quite a while before your actual procedure time. Time at the hospital actually wasn't bad at all. So once I got there, I went ahead and checked in at the desk, and within like about, I would say 10-15 minutes, a nurse came and got me, and they took me back to the OR prep room. So this is where they get you hooked up to your IV, start fluids on you, start monitoring your vital signs, and it wasn't bad. And then after about 10 minutes after I was back there, they got me hooked up to all the machines, and they also put blood circulation devices on your legs to help you circulate your blood so you don't end up with clots and things like that. This is also the part where you end up meeting all of the staff that will be working on you during your procedure. So I met the anesthesiologist assistant, the anesthesiologist, all the nurses, and then they actually administer the first part of your anesthesia in the OR preparation room, and then that's when you go back. I honestly don't remember absolutely anything. After they gave me that shot of medicine, I actually remember having like a whole conversation with my husband, and apparently it was all in my head because the minute they gave me that shot, I was just like giggling uncontrollably. And I thought I was telling my husband like, oh, I love you and I'll see you whenever I'm out, but no, I was having a moment of craziness, and apparently I didn't say any of that. So you will be very loopy once they give you that medication. And yeah, there's some good drugs. So how was waking up from anesthesia? Honestly, for me, like, it wasn't bad. I actually didn't have any pain level, but the thing is, like, I feel cold really easily, and they say that a lot of people coming off of general anesthesia, like, get extremely cold. So I was, like, whining after surgery, and they thought that I was in pain, so I think they dosed me with, like, more pain medication, but really I was just, like, freezing. She put, like, so many blankets on me, and I think I was back in the post-surgery room for about an hour and a half before they took me out and placed me in my regular hospital room that I'd be staying the night in. My highest pain level throughout the entire procedure was maybe like a 3, if not a 4, and very rarely a 4. I had one incision on my pelvis that's the one that would really bother me, and it was sore. But my recovery process was a little bit different just because I ended up being allergic to the antibiotics that they were administering me. So most people have the most difficult times, like days 1 through 3, and mine kind of ended up being towards the latter end of that. So maybe like 5, 6, or 7, because that's when I started having a reaction to the antibiotics. I started getting really itchy, and I broke out in this like red rash everywhere. And on top of the bruising, like, it was a horrible experience. So if you do see yourself like starting to get itchy, like, just monitor it, because I was like, oh, maybe it's the pain medication or my skin's just sensitive, but don't just brush it off, like, actually have it looked in. But I'm stubborn, so like I waited a while, and it kind of like prolonged my recovery period. So while every surgeon's requirements are different for the period that you're not supposed to be sitting and things like that, Dr. Cortes's restrictions are pretty on the more extreme side of plastic surgeons that I've heard of. So he actually doesn't want you sitting or laying on your hips for 3 months. Like, right now it looks like I'm sitting, but I'm actually like hanging my butt off the end of a stool. So that's like an easy way to sit. And they do actually give you a pillow to sit on after 2 weeks. So the pillow is just like it's like a styrofoam, like, foam roller almost, but instead of it being like completely round, it's flat on the one side, on the bottom, and you just sit with that underneath your thighs, and that takes pressure off of your butt. Now, initially I was not able to sit on that. It was like extremely uncomfortable for me, so it's just something that you kind of have to get used to as the days go on, and just kind of listen to what your body is telling you. So I only ended up starting to really sit on that probably like 3 weeks out for my surgery. Ooh, my CC level. I know y'all are wondering about that CCs. So Dr. Cortes did put 1,000 CCs in each buttock, and he also did hip fat transfer for me as well. So the thing with him is he does include that with his BBL if you do have enough fat for him to transfer. So I have 600 CCs in my hips. So my experience with the faja so far has not been bad, but honestly it's very uncomfortable for me to wear, and like, I'm honestly dreading the 3-month period of having to wear it pretty much till October. But make sure whenever you do get out of that first week of surgery is when they put you into your permanent faja. And I do this because you'll end up switching fajas multiple times just because you're so swollen the first time, and you end up, like, I was pretty shocked, you end up losing the swelling very drastically. So I kind of screwed up, and I was too scared to go into a smaller size faja the first time, so I ended up having to purchase that one. So I'm like now in my 3rd faja, which is now also too big. Make sure that when they put you in your faja though, that you're not getting a size that you're not able to get out of, because I kid you not, the first time I had to go to the restroom, like, my husband had to cut me out of the thing. Like, we had to cut it and I had to sew it back together. So just make sure that, like, it's fitting, but it's not like too tight, because whenever you put the faja on, your butt will swell, because the way that it is it has like 2 like holes for your butt cheeks to go into, and the minute you put that on, like, your butt like swells on the inside of that thing. And even though the faja was like big in the torso and all of that for me, like in the butt, like, it got so tight and swollen, like I like had like red marks from the garment. So just make sure that, like, you're 100% making sure that they're putting you in the right faja. Make sure that you can breathe in the faja. The other girl that had her surgery the same day, she stayed with the nurse, and the nurse was like telling us that, like, she got nauseous, like she couldn't breathe. And the first time you do take off your garment, you need to be laying down or like holding on to something, because you can feel very lightheaded due to it kind of a change in your blood pressure when they take that thing off, because you're so constricted and all of a sudden it's like, oh shit, I'm free. So just make sure that like you're being careful with your faja process, and you can buy the foams and things like that, and that helps me a lot with having to buy new fajas, because it kind of helps compress the areas that need more compression without me having to switch it out. And I will say Dr. Cortes's office is probably the cheapest I've seen these things. So there's a mall close to me called Grapevine Mills Mall, and over there they're selling them for $150 to $200. At Dr. Cortes's office, they're $90 each. So while still expensive, it's a lot better than having to pay double the price and probably getting it somewhere near you. If you are out of town and you do need another one, you can always call them and they'll just ship it to you. So something really important in your recovery process is getting your lymphatic drainage massages. And I honestly started mine kind of late, just because of the reaction that I had to the antibiotics, gave me a skin reaction. I just didn't want to aggravate my skin any more than like it already was by like messing with massage oils and things like that. So I waited probably until like my third or so week to start my massages, between my second and third week to start massages, and it helped immediately. Like when I tell y'all, like I could not even bend down. My skin was so tight and so constricted, and you will get hard spots. You will get hard spots from the liposuction. That's completely normal. Don't freak out, but they can be very painful. I had a first hour massage, and after that first hour, I was actually able to bend down and touch my toes. So there was like a huge improvement of the hardened spots, of everything. And I know that a lot of people go like maybe like every 2 weeks or like once a month. But for me, honestly, I would recommend you going every week, because the hard spots do move. So initially I had most of them probably right here. And while this area is still really hard, they've kind of moved up into my rib cage here, and that's really painful, because every time I want to twist or something like that, it sends like, it's just difficult. You feel like a lump here almost. And they do take probably about 6 months to a year to completely dissipate and go away. If you do live in the DFW area, however, and you are getting this done and you want names of a couple massage therapists that I recommend, just shoot me an email and I'll be happy to get back to you on that.